I engaged with a multidisciplinary group of professionals that included policymakers, legislators, lawyers, medical doctors, nonprofit leaders, and business owners, all overlapping with public health. On this episode, I'm sharing my experience serving as moderator for the American Public Health Association's Policy Action Institute. This event was held in Washington, D.C. in mid-June of 2025. You're listening to the PHEC Podcast, episode 415. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations, community health foundations, and government agencies. We specialize in helping our clients communicate their data and health information in plain language to the communities they serve. The support we provide often falls in the category of strategic planning, sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization as well. Links will be provided in the show notes. Now, on this episode, I'm sharing an example of our communication support provided through moderating the American Public Health Association's Policy Action Institute event, which was held in Washington, D.C. this summer, mid-June of 2025. Now, are you familiar with the Policy Action Institute? I guess we should start there. Before I go too far, I want to make it clear, this is not an ad or any paid advertisement. They didn't ask me to do this. I'm sharing my own perspective and view, my takeaways from my experience. So this is something I'm doing on my own. It's something that I want to share with all of you. It has nothing to do with any agreement or paid advertisement or anything like that. So what is PAI? Well, it is an intensive 2-day event. You have a mixture of panel discussions with top policymakers, legislators, thought leaders. You are also engaging in workshops, and there are networking sessions as well. You get to learn how to navigate funding cuts, influence policy, and drive change, and secure critical resources for your initiatives. Now, there is a third day. It's an optional day where you have the opportunity to participate on the Hill. You visit the Hill, and you have the opportunity to meet directly with policymakers and their staff and advocate for public health priorities. You get to meet with the folks that are representing the area that you live in, the state that you're from. And the folks at APHA will provide you with like a variety of resources and training. They really prepare you for that day on the Hill. So it's not like you're just expected to know what to do or thrown into anything. They give you a great deal of support and guidance, and it's a pretty incredible experience. To be honest with you, I've heard of Policy Action Institute, PAI. I get the emails. It was on my list of things I'd like to attend or do one day. And I finally had that opportunity this summer. And whatever I thought it was, it really turned out to not be that. It far exceeded my expectations. And it's not like I felt that my expectations were low. I'm just not sure what I thought it was going to be, but it really, really blew my mind in a sense that if I had known it would be like this, I would have prioritized attending sooner, if that makes any sense. Okay, a little bit of context in terms of the timing. So PAI was scheduled. It's always in the summer. Every year it's in the summer, so it's in June. It was scheduled for a Monday and Tuesday, June 16th and 17th, with the optional day on the Hill was Wednesday, June 18th. Now, these dates are significant. All right. So I traveled into Washington, D.C. on Sunday, June 15th, so that I could settle in and be ready to start bright and early on Monday morning. Well, the day before I was scheduled to travel into DC was Saturday, June 14th. That was our president's birthday and the big U.S. Army's 250th anniversary parade in Washington, D.C. Now, I don't know what your views are. I tend to lean on the side of this is a big birthday celebration he wanted for himself, camouflaged by the celebration of the U.S. Army's 250th parade. So there were all over the news that week leading up were images of these big tanks that were brought in for the parade. And it had just a very, I don't know, the vibe didn't feel very good watching any of that across the news and the anticipation of this parade, along with protests that were happening and a lot of conflict in the state of California, the city of Los Angeles, more specifically, regarding the ICE raids and how people were being hurt and all of the things that were going on in Los Angeles was really heavy in the news during that week leading up to this big parade that was happening on Saturday, the day before I traveled into DC. Not to mention, there were also over 2,000 protests, No Kings protests, already scheduled for that same day. So this is really our country demonstrating and being very vocal about how unhappy they are with our president and this current administration. So that was all happening. These over 2,000 demonstrations, protests were happening around the country. I don't know that any specifically were happening. I'm sure there were some around DC, but in the city of DC, it was all about that parade. And the tensions were high. I got all sorts of travel alerts. We should anticipate delays. And it was already a high stress time, but my anxiety about traveling into DC in this particular moment was extremely high on top of, the normal anxiety you have when you're going in to moderate an event like this one, or, if you're speaking or leading, giving presentations. I mean, there's already a level of anxiety that exists with that. But then you add all of this dynamic, it was pretty intense. So I just didn't know what to expect. I was also a bit intrigued because I felt like the people who were showing up for PAI this year, especially under all these circumstances, were really ready for some change. Like these people that were showing up during this time, I felt like were the people that were pressing through and they needed to be there. They needed something to change. They needed some resources, some inspiration. Like these people were pressing through. So as much as there was stress and high anxiety, there was a lot of intrigue to see just what would happen and what the experience would be like with all of these amazing people that were making their way through and to be at this event despite all that was happening around us. Now, I'm sharing all of this in context, and I want you to, as you're listening to me, I don't know if you're here in the United States, this is very familiar, but you may be in other countries. And I have colleagues in other countries that I'm in regular contact with. And I'm always aware of the fact that this podcast has a very global audience. And I know from one of my colleagues that reached out to me to really ask, like, what was it like to be there? Because when you're in another country watching the news and what's happening in our country here in the United States, I can only imagine what's going through your mind and how that's interpreted. I mean, I know what it feels like to be here in it, but I also can only just imagine what it is like for you to hear it and watch it from the media. So I want to just another reason for me to share my perspective and what happened. So the big question is really like, what was the climate in the room? What was it like to be there? What were the conversations like? What was the tone like? And so that's a big part of why I'm sharing this, and I'm sharing so deeply and taking my time to articulate some of these, putting the picture together of the timing. Okay, so moving into a few takeaways. I think that everyone should plan to attend this conference to experience it for yourself. Like I said a few moments ago, I don't know what I had expected it to be. I expected it to be good, but I think I put policy and advocacy into some sort of dry category. I'm not sure why, but I just expected it to be, I don't know, a little mediocre. I don't know. It's hard to put words to it. But if you are anywhere between curious about policy and advocacy to boldly walking the walk and talking the talk, you'll find yourself at home here. I think that's probably the best thing that I can say to wrap this up. I really encourage you to push this higher on your agenda of places to attend or conferences to attend. And if you can make it happen, I highly recommend attending this conference at least once. I think once you attend, you're going to be like, oh, I've got to do this again. But I really encourage you to do that. That's my personal strong recommendation for you. Here's just some of the takeaways. And I can't share everything. I'm still processing, honestly. I'm recording this about a week after being attending. So a lot of this is still rather fresh and I'm still processing. And also from my perspective, I was also working and attending. So like I'm serving, but I'm also trying to take in. So it's a little bit different than maybe some of the attendees who have shared their posts on social media. I know I've seen several posts on LinkedIn, which are great. Okay, so one of the biggest strong themes that kept emerging was the importance and the encouragement to engage with policymakers. Now, under this theme, I would say the importance of public health storytelling and effective legislative communication was strong. We have to remember that it's not just about the data and the numbers, but the numbers represent people and the people have a story. So being able to really have good storytelling, putting the people, their names, their stories with that data is extremely effective and it helps you connect with the legislators. Now, this came from legislators. State legislators said this to the audience, and it also emerged in several other conversations around those 2 days of events. Another takeaway was this importance of using plain language, focusing on access to healthcare and health need as opposed to, using so much jargon, industry jargon. We really have to move away from that. And if you're a regular listener of this podcast, you've heard me say that over and over and over. You're probably sick of me saying it. We don't have it down. Some of us do it better than others. And it's something that I think we're always going to need to set an intention to really use plain language. It's one of the things I enjoy emphasizing when I talk about the services we offer through our consulting. We really take the epidemiology, we do the research, we do the analysis, we write the report, but we make sure that whatever that final deliverable is in plain language. People need to be able to relate to, what we're sharing, what our points that we're trying to lean into, what they are. So that's an important theme that kept coming up across the conversations those couple of days. Another really good takeaway was to do your homework, really get to know the legislators and what they've supported in the past, especially around vulnerable populations like children and elderly. It's important to know what are the policies that they really stand behind and what have they supported in the past. And that will help you as you're working to engage with them and communicate with them to already know kind of where their heart is. I think along with getting to know, doing the homework and getting to know legislators, find out their why. Now, this came up in a couple of conversations across those different events, the 2 days, but really find out their why. Remember that policymakers are people too. They are passionate about a certain agenda, topic, issue, because typically there's a connection there, a personal connection there, something that they've gone through or someone close to them has gone through. They have a strong opinion or view about something based on their own experience. If you can really connect to their why, that really sets you apart and it gets you an advantage in terms of positioning. It just helps to connect with them as a person. It humanizes the whole experience. And, policymakers are people too. We're all human. And if we can find that human connection first, then everything else starts to fall in place. It doesn't mean that you agree on absolutely everything, but you connect on that human level. So finding their why around some of the policies and what they lean on and really support is a good segue into building relationship with them and engaging with them. Also, this is interesting. Very few legislators actually have health backgrounds. So when you think about that, I don't know, that hit me a little differently. There was a percentage that was quoted, and I can't remember it, so I won't say it, but it was a very, very low percentage of legislators who have health background. So when I hear that, when I internalize that, what I'm realizing is not only Do we need more public health professionals in office? Absolutely. But I think there's an opportunity for easy engagement and for partnership and collaboration, because that also was resonating across several conversations from speakers and legislators, and the opportunity to collaborate, bring your public health expertise to those legislators, policymakers, and partner in a way that you can provide the background and the context for any health issue that they may be missing, or maybe they're counting on it coming from somewhere else. And we don't know what those other sources are, how credible they are, how strong they are. They could be making decisions about policy involving health from a place of misinformation, or not the full view, or not a robust, health background. So you could provide that information so that at least it's an opportunity to influence their decision and to help them make decisions based on science, and help be that thought leader, that thought partner with the policymaker. Have you ever considered that? I mean, we hear that a little bit, but in the room across those couple of days, that really rang strong and loud. So these are a few things that I want to be able to share with you. There were several times when speakers made statements that strongly resonated with me and echoed points that I've repeatedly made as well. For example, the importance of plain language, as I mentioned earlier. The importance of plain language storytelling to humanize data goes a long way toward building connections with stakeholders and having a greater impact on communities that we serve. People don't want to just hear a lot of numbers and scientific jargon. They want to know about the real stories that are represented by those numbers. Also, the power of cross-sector collaboration and creative partnerships cannot be ignored. Multidisciplinary examples in the room included politicians, legislators, lawyers, medical doctors, nonprofit leaders, and business owners, all overlapping with public health. We must proactively look for and act on these opportunities to foster conversations and partnerships as a part of our strategic plans. We had state legislators literally ask for that. One of the questions I framed was like, how can we as public health professionals help you communicate the importance of these health issues to your partners and colleagues? And they returned with reminding us that they aren't always the experts on these public health issues or these health issues. They don't speak that language. And we need to be able to break it down and explain it to them in a way that they can relate to and they can move on quickly with. And we have to get better at that as public health professionals. I think that they're letting us know what they need from us. And if they need it to be more plain language and more actionable bite size, then let's share. Let's give that to them. Let's support in that way. I was pleasantly surprised by several things as well. Given all of the devastating changes to public health since January and our current political climate in the U.S., I wasn't sure of what to expect at PAI. Along with my own preconceived notions about whatever it was going to be, it's been a stressful year so far, and we've all felt it. However, the diverse, multidisciplinary group of professionals who showed up brought knowledge, a desire to ignite change, a passion for serving in their own communities, and an openness to share and learn from each other. There were respectful differences of opinion. There were a lot of very different people in the room. And there were times when some people made comments that the other people in the room completely disagreed with. But we all unanimously agreed on the importance of protecting and advancing public health. That created a refreshing atmosphere that was energizing. I was so impressed. I was so happy. I was very excited. I was thrilled. I was really encouraged by the way we were able to communicate. Even amidst our differences of opinions and views, we were all able to communicate so effectively, and we all listened to each other. And that was incredibly just refreshing to experience. So serving as moderator, my personal goal for PAI was, and I expressed this to the planners all along, the entire time that we were putting this together, but my personal goal for PAI was for attendees to leave feeling uplifted, inspired, and prepared to take action. And I believe that goal was accomplished. I am forever grateful for the opportunity to serve as moderator for PAI of 2025. I, once again, encourage you to put this on your agenda for maybe next year or even a year after that. But I really encourage you to attend at least one Policy Action Institute event in the very near future. I would recommend next year since that's, we've got a year to go ahead and plan for it, but it happens every June. But it's an experience that you won't regret. As I wrap up this episode, I'd like to remind you that I'm available to support your organization if you're looking for a moderator or related capacity building support in the area of leadership or workshop facilitation. Please reach out through our website, drchuntley.com. I'd be happy to meet with you and explore how I might be able to support your organization as well. Links will be provided in the show notes. Now, the show notes page for this episode, which is episode 415, can be found at phecpodcast.com. Once you're there, navigate to episode 415 to find the show notes. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.